And good evening, and welcome to this episode of the Your Health is Important radio broadcast. This is Dr. MJ Collier, your host, producer, and on-air personality. We are live here to answer your healthcare questions. We want to thank everybody for joining us this evening because we know you have options and you have things to do. So we want to make sure that this gives you just the information that you need. So welcome. Let's get this show started. Thank you so very much for being here today. Okay, so thank you once again for being here on the Your Health is Important Facebook Live broadcast, and we're here to answer your healthcare questions. I'm once again your host, Dr. MJ Collier, and we're going to talk about a variety of subjects today. Let's start off with colorectal cancer. Colorectal cancer, this is Colorectal Cancer Month. This is once again a disease process that disproportionately affects people of color. That's African American, Indians, Asians, Hispanics, more so than Caucasians with this disease process, but the rates are going up annually for each of those groups, including Caucasians. And we don't know why this is happening. We just know that the incidence is going up. Now, let me say from the very beginning, colon cancer is one of the easiest to diagnose cancers. It's also one of the easiest to treat cancers. And if diagnosed early, the cure rate is more than 90%. And that is highly unusual with virtually any cancer diagnosis. So we want to make sure that you are getting screened. Now, the current guidelines versus the previous guidelines. The previous guidelines, good evening, Audrey Sinead. Thank you so much for joining us this evening. Coming all the way from Louisiana, Marco Perry. Hello. Glad to have you back, Marco. We appreciate you. And Antoinette Hunter Grayson, Georgia. Thank you, Antoinette. We appreciate you. I'm loving that sunroof, girl. Carolyn Brown from Detroit, Michigan. Thank you, Carolyn, for joining us this evening. We appreciate that as well. Ernest Gibbs, my man, you got the greatest picture of all times, and I love hearing from you, Ernest. Thank you for being a regular. You tune in. I want you to share this information with everybody. Pam Miller, hello. Thank you so much for joining. We appreciate you as well. Billy Sue Combs, Billy Sue from Midlothian, Texas. We got north, south, east, west. Remember, we want to know where you're from. So California, New York, Florida. We got Corpus Christi in the house. Shanta Jackson, Pillichet. Thank you, Shanta. We appreciate you being here. Beverly Dunn from Forsyth, Georgia. You don't have to see the whole staircase. Just take the first step. Boy, those are words I'm going to utilize. Janae Allen. Hi, Janae. Thank you so much for joining us this evening once again. Tanya Williams, hello from New Orleans, Louisiana. We got New Orleans in the house. Cynthia Beaumont Johnson from Moore, South Carolina. Beautiful picture there. Teresa Lamar, Grand Rapids, Michigan. So Michigan, Florida. What we got going on out west? Winnie King. Hello, Winnie. Thank you so much for joining. We appreciate you. Now, colorectal cancer, once again, Bertha Point from Paul's Island, South Carolina. Paul's Island, South Carolina. That might be the first that we've had that. Tawanda Robinson Winfield, Baton Rouge, Louisiana. Michelle Shelby, Atlanta, Georgia. Thank you, Shelby. We appreciate you joining in, my friend. Jackie Daniels, good afternoon, Dr. Collier from Tallahassee, Florida. Jackie, thank you so much for joining us from Tallahassee. We appreciate that. Okay, Sean, Big Time Green. Okay, Sean, we were wondering where you were. It's from Monroe, Louisiana, representing well, and we appreciate you being big time in the house. Andrew Presswood Jr. from Perry, Georgia. We got it. So I'm going to scroll through those, but I want to get back to our topic. Patrice Logan from Greenville, South Carolina, colorectal cancer. Traditionally, the colorectal cancer screenings were conducted at age 50. And then most recently, within the last few years, they decreased that number to age 45 for African Americans. And then most recently, within the last year, they have a thing called Project 2020, Healthy People 2020. And they decided that everybody, black, white, orange, brown, green, should have their colonoscopies at age 45. Now, that's one caveat. The other caveat is if you have a family member that has been diagnosed with colon cancer, then you take 10 years from the age at which they were diagnosed backwards. And that is the age that everybody else in the family should be screened. So if they're 50 years old and they're screened and they're diagnosed with colorectal cancer, then everybody else in the family needs to be screened at 40. If they're 45, everybody needs to be screened at 35. I have had patients as young as in their 20s diagnosed with colorectal cancer. So it is very important that you have yourself tested. Now, and the primary test, of course, is a colonoscopy. They do have a test called the FIT test, which you do on a stool specimen. And there's a new test called the Cologuard. You may have seen it advertised on television, where you basically collect a specimen at home. You put it in a sample collecting bottle. You ship it back via UPS back to the lab, and they get back with you in the next couple of days to tell you what your test diagnosis is. And that is a test that looks for genetic samples from cancer cells. So it's very specific, it's very selective. The thing about either of those tests, other than the colonoscopy, is if there's something wrong, you still have to have a colonoscopy. But if for whatever reason you can't get a colonoscopy, don't want to take the time off of work, can't do the prep, which is basically at no less than a half day, usually a whole day of colon cleansing diarrhea, then it's very important that you try or have one of those tests performed. And again, if either of those tests is positive, then you are required at that point to have a diagnostic colonoscopy to determine what your disease state is. Now, when I order the test, when Dr. Collier orders a test, and when that test is ordered by most physicians, it's ordered as a screening colonoscopy. That is a test that during Affordable Care Act under President Obama, they determined that there were 13 things that should be covered by every insurance company that exists. Colonoscopy being one of them. Other examples are PSA, prostate specific antigen test for men, mammograms for women. But there are 13 things that should be provided to you at absolutely no cost. That is the screening colonoscopy. Screening colonoscopy. So when you are having this test ordered by your primary care physician, your family physician, your internist, make sure that they asked for a screening colonoscopy, because a screening colonoscopy is provided to you at absolutely no cost. Now, you're going to take a screening before you go. They're going to ask you about certain things, such as have you had rectal bleeding? Are you having problems with changing the color or character of your stool? And who has not had rectal bleeding on occasion? Who has not had blood on the paper when you wipe yourself on occasion? But if you answer that question in the affirmative, then they're going to convert you magically to a diagnostic colonoscopy. And a diagnostic colonoscopy comes with a price tag. And so one thing I learned at a recent meeting of the Atlanta Medical Association as well, that some freestanding facilities will charge you a facility fee, even if your test is covered by the insurance. So you have to make sure that you're not getting any surprise billing, that you go get the test and you ask for a screening colonoscopy, and that test should be provided at absolutely no cost. So I'm going to get back to colorectal cancer, but right now we're going to open it up because this is your show. This is your show. We answer the questions that you are interested in having answered. So let's get to it, Havlik. Let's find out what the listeners ask. What are the heart attack symptoms for women from Grand Rapids, Michigan? Ebony Bell, that might be the question of the day. Ding, 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 ding. Because the heart attack symptoms for a woman are totally and completely different from that of a man. Oftentimes, a woman will present with fatigue. She may present with anxiety. She may present with chest pressure, but no pain per se. And this is oftentimes misdiagnosed in the emergency room. And we're trying to sensitize doctors in the emergency room to understand that women need to be evaluated differently than men. Men will universally come to the hospital complaining of crushing chest pain. They give the universal grip sign, chest like this, I have crushing chest pain. And more often than not, they will use the term, it feels like an elephant is sitting on my chest. Although the term elephant is never used in their vocabulary under any other circumstances. So those are key hallmarks and triggers that make, everyone go into action when a man presents with chest pain. He also may have nausea, vomiting, and diaphoresis. That is heavy sweating, where you really, the sweat is pouring out of you. Now, women can have that. They may have diaphoresis. They may have nausea. They may have some vomiting. But oftentimes, women are misdiagnosed. They're having acute heart attacks, and they're diagnosed as having anxiety. As some older doctors would say, hysteria. And so there's been multiple cases of women that were diagnosed with anxiety, panic attacks. They give them anti-anxiety medication to send them home, and they die because they were having a heart attack and it was misdiagnosed. So we want to make sure that is not the case for the women that are listening to this practice in this program. If you are having any substantive significant change in your health status, cough, wheezing, shortness of breath, you feeling anxious, you're not sure why, a pressure sensation in your chest that may not necessarily be described as pain. All of those things require a thorough evaluation, and be your own advocate. Don't let them say it's a panic attack or anxiety and dismiss you from the emergency room without performing a thorough and complete workup. Great question, Ebony. We appreciate that. Okay, can I explain about bowel salts? Bowel salts are used to bind to cholesterol. They're oral salts that you take in. The purpose is to bind the cholesterol and triglycerides and remove them from your blood system. They work in the GI tract. So bowel salts are a really old school way of lowering your cholesterol, but they are being reevaluated now as better therapies because they also help with intermittent constipation or constipation that alternates with diarrhea. These are things that people can suffer from, and the GI benefits of the bowel salts are far and beyond and greater than just lowering the cholesterol. So they are effective at lowering the cholesterol, not as effective as statins are. And for patients who can tolerate them, no problem. It's just, again, a natural way of people say, I want to do things naturally. I don't want to take medication. These are things that they have prescription type products, but they also could be obtained over the counter as well. A lot of naturopath physicians will prescribe them to improve your cardiovascular health. So that's where we are with bowel salts. Great question, Marilyn. Buswan Scott. Okay, do I suggest medicine for a person newly diagnosed for MS, 26 years old? Yes. I recommend medication for anybody that's newly diagnosed with any disease state that requires medication. They have phenomenal medications now for MS. They have pills, they have injections. Some injections you take daily, some injections you take once a week, some injections you take once a month. So there are various therapies depending upon the type of MS, if you will, the stage that you're in when diagnosed, and how you're going to respond to therapy. So very important that you start therapy as quickly as possible, because MS is a progressive neurological disease that can start off with generalized weakness. I have a patient now that has low extremity weakness, is starting to have problems falling, cannot lift his leg up high enough to get into the tub, or more importantly, to get out of the tub or shower. And so he's at risk for fall every time that happens. So it's very important that you start treatment early to minimize the symptomatology. You can slow the progression. MS is a progressive disease, and MS is multiple sclerosis. Multiple sclerosis, again, I think is being overdiagnosed in this day and age. There's not necessarily an MS test per se. MS is a diagnosis of exclusion. We have looked for other things. It's not those things, so we're going to call it MS. There are some definitive testing that can be done with brain plaquing, etc. But more importantly, just with blood tests, etc., there's no definitive way to diagnose it, but the diagnosis is made based on your history, your presentation, and the signs and symptoms that you have. So again, one of the things that they do is start people on medications for MS. And if their symptoms improve, that answers the question as to whether it's MS or not. So great question, Vaswan. We appreciate that. Angela Haynes Lewis. My doctor just put me on thyroid medicine, progesterone, testosterone, and estrogen as a result of my recent blood work. Should I expect to achieve a slimmer waistline and increase libido from this combination of drugs? Absolutely, positively. Angela, you are getting bioidentical hormone replacement therapy, it sounds like. And so it's important when you take estrogen in particular that you take a progesterone product to protect the uterus from unopposed estrogen. You can get things like hypertrophy of the uterine lining that can cause excessive bleeding. So progesterone stops that from happening. Testosterone will increase your libido, increase your muscle mass, and decrease your body fat. Thyroid will improve your metabolism and improve your general overall mood. So this doctor is doing something very, very unique, and it's something that I do in my wellness center called Ageless Atlanta. And we do bioidentical hormone replacement therapies, and that combination is exactly what you do. The thing is that you also customize it to the person. You give them the exact doses that they need. So you're going to really, it's going to be morphing. It's going to change your not just your waistline, but your entire somatotype. You're going to look and feel younger, although based on your picture, you have a baby face. So you're not going to, it's not much younger you're going to look, but you're going to really feel the way that you did 10 to 15 years ago. So this is life-changing therapy, bioidentical hormone replacement therapy, BHRT, something that they're using at age centers now, something that people are requesting and asking for because they want to be younger, they want to be slimmer, they want to be trimmer, they want to be a better version of themselves. And that's what you get with BHRT. Great question, Angela. We appreciate that. Billy Sue, what is the best way to treat Baker's knee? Okay, that's Baker's cyst. That is a cyst that's approached from the posterior part of the knee. When you look at the knee joint, there's the thigh bone, which is on top, and then there's the leg bone, which is on the bottom. And those two bones come together and form a joint, which is the leg. Now, between those two, there's like a balloon full of a gel type substance. This is to prevent the bones from grinding on each other. And there's also cartilage, which provides a cushion so the bones aren't on top of each other. Well, sometimes that balloon can get twisted and you get a balloon-like projection that's similar to when a clown takes a long balloon at a kid's party and twists it and makes a poodle or some other animal out of it. So you end up getting a tiny little twist in the knot, and that forms on the back side of the knee. It's called a Baker's cyst. So what I do in my practice is I will drain a Baker's cyst up to 3 times because the body will sometimes repair it and heal it. And so even though you puncture a hole in the balloon and remove the fluid that's in there, sometimes the body fixes itself and it fills back up with fluid again. So I'll do that up to 3 times. By the 3rd time, if it's not there, then it's important that you just take the entire balloon out. That is a more extensive surgical procedure and one that can't be done under local anesthesia. That's going to require going to the hospital where they literally just cut the balloon out, sew it up, and then allow it to still provide cushion between the thigh bone and the leg bone, but there's no bulging of fluid behind the leg. So that's called a Baker's cyst. And that is a phenomenal question, Billy. So thank you so much. Luisa Prather, I had a cough for close to 2 months. My primary care said he can't find anything and recommended ENT. Should I be afraid of something serious? Oftentimes a chronic cough, if it's not caused by a medication, the most common being the blood pressure medication lisinopril, causes a dry cough that's non-productive, and it goes on. And you could have been on lisinopril for years, and all of a sudden you start having that cough as a symptom. It doesn't happen necessarily immediately. Other people start taking lisinopril or drugs like it because other medications in that class of drugs referred to as ACE inhibitors, ACE inhibitors, can cause that. So you stop that medication and the cough goes away. Sometimes you can substitute it with a similar drug in a similar class, still keep your blood pressure controlled and not have to worry about the cough. Other times, acid reflux, gastroesophageal reflux disease, or GERD. The acid comes up and irritates your airways and causes you to cough. So that's one of the symptoms as well. They're sending you to an ENT because there also could be postnasal drip that's putting mucus directly into the back of your throat and causing an irritation that your body doesn't like, and it makes you cough. So there are a variety of reasons that you could have coughing. Those are just 3 of them. A good thorough examination by an ENT, including now they're doing nostroscope or nasoscopy. They'll stick a tube down in your nose and it's got a camera on it, and they can look around and see if you have things like nasal polyps. They can get all the way to the back of the throat and to see if there's anything going on back there. So no, don't be afraid. It's probably nothing serious. Coughing rarely is unless you're bringing up blood-tinged sputum. If you're coughing up blood-tinged sputum, that's another problem. But if you're just having a cough, then it's probably nothing to be concerned about. It's just more of a bother than anything else. So great question, Luisa Prather. We appreciate that. Marlene Labradio Kennedy. What can you take for stomach bloating? Stomach bloating is a symptom that you really oftentimes is caused by too much bad bacteria in your stomach. The bad bacteria create gas. That gas causes you to get bloating. It also may cause excess belching or burping and excess passing gas as well, because the GI tract is one long tube from your mouth to your rectum. You have your mouth, your esophagus, your stomach, your small intestines, your large intestines, your sigmoid colon, and your rectum. The name changes to protect the innocent, but it's still one space. And so when you get gas backing up in one space, it's got to go somewhere. Sometimes it doesn't necessarily come out easily, and so it just starts to stretch your intestines out, and you get a bloated stomach. That makes it, because there's now something occupying that space, which is gas, it's difficult to put food in there or anything else in your stomach. So you end up feeling bloated. Your stomach sticks out inches. It's an unflattering look when it's bloated, and it's easy enough to take care of. How? Number one choice, probiotics. You take a probiotic product like our Lipo Biotics, take 1 capsule in the morning, 1 capsule in the evening, or you can take 2 capsules, say at night after dinner or before bedtime. That will replace the bad bacteria with good bacteria, less gas being formed, a more pleasant and fragrant breath, a more pleasant and fragrant bowel movement, and it just improves your overall GI health, not counting the benefits as far as allergies are concerned. And I'm talking about sinus congestion, sinus drainage, chest congestion, cough, itchy throat, skin rashes such as eczema, all kinds of allergy problems. You benefit greatly. If you have food allergies that have been undiagnosed, taking probiotics can correct what's called and commonly referred to as the leaky gut syndrome. So go to the website, lipodrops.com. Look at the probiotic product. This will be life-changing. This is, again, one of the things that Dr. Collier recommends on a daily basis. Probiotics. Vitamin D, like our Doctor's D product. This is the vitamin D, 5,000 international units of vitamin D taken on a daily basis. And omega-3 fish oil. These three supplements, our Lipo Omega, our Doctor's D, and our Lipobiotic, will be life-changing for you, because the Lipo Omega addresses everything from cardiovascular health to joint health. It's a natural anti-inflammatory, so it decreases the amount of inflammation in your body. The vitamin D does the same thing. It is cancer preventive as well. And then the probiotics for GI and immune health. Those three supplements, I don't care what your age is, I don't care what your sex is, so male, female, young, old, no matter what other prescription medications that you may be taking, all of these products are perfectly compatible with any prescription medication. Except if you have a history of fish allergies, you can't take the fish oil. Then I recommend other type of omega-3 products, and there are multiple that are not fish-based. But if you have no issues with fish or seafood, then you can take the omega-3 fish oil, and then that will overall improve your health. This is Dr. Collier's trifecta, his trio for life. These are the things I recommend. These are the things that I personally take on a daily basis, and I have what I consider reasonably good health from taking them. So get those products, go to the website, lipodrops.com, look up why you should take probiotics, why you should take vitamin D, why you should take omega-3 fish oil. So great question, Marlene. We appreciate you. Okay, Tasha Demetrius. All the Lipo drops, does it help with sugar cravings? Yes, it does, because it decreases your appetite. And oftentimes people are craving carbohydrates. Sugar just is one of the best tasting carbohydrates, but it may manifest itself as craving potato chips or craving ice cream or something to that effect. I know that on occasion I will crave ice cream, and I will have to pull into a Wendy's and get me a Frosty. Just on my way home, because I just have the overwhelming urge to have something like that. But the Lipo Drops helps with that tremendously. You can take them as needed to curb those cravings, but the recommended dosing is taken before meals, breakfast, lunch, and dinner, to curb your appetite and keep your appetite under control, with all the other benefits that you get from B vitamins and C vitamins that are in the Lipo Drops product. So great question, Tasha. Okay, Cheryl Williams, can you discuss recurring bone spurs? Bone spurs are caused by excessive calcium, usually in a joint. The most common areas are the foot. You can have bone spurs on the lower portion of the foot. You can have spurs on the Achilles tendon. You can have spurs in your elbows. With excessive calcium or injury or trauma to the bones, your bone tries to heal itself by laying down more calcium. If that calcium goes down a tendon, it will give you a pointed calcium spear that's like, again, a sharp pointing out, like you have glass in there or something like that. It can be very uncomfortable, very unpleasant, and usually has to be treated surgically. There are some exercises that you can do to stretch out muscles and tendons so that they're not pulling and tugging at their insertion points and causing spurring. But again, it happens more often than not, particularly in the feet. You can start out by treating with some shoe inserts, or you can get something custom made. They have great shoe inserts at most stores now. They can evaluate your feet in a digital manner. They can evaluate your feet to determine the exact shape that you need, exact support that you need, etc. If not, you go to your friendly neighborhood podiatrist, and they can create some custom inserts for you that can help relieve bone spur pain. Great question, Cheryl. We appreciate that. Okay, Ernest, there you go. Should women who have a family history of cancer use bioidentical hormone replacement therapy? Ernest, it depends on the type of cancer, and it depends on how long, whether that person has cancer at all. But they used to deprive men and women of bioidentical hormone replacement therapy based on the cancer history, and now they're realizing that not only shouldn't they do that sometimes bioidentical hormone replacement therapy can help with a person post-treatment for cancers in a variety of different ways. So now most men are eligible for testosterone therapy after they've had prostate cancer diagnosis and their PSA has been down for at least a year. Some doctors will say 5 years, but they found out ultimately testosterone does not cause cancer. It is not a cancer-causing agent. That the prostate itself can only absorb a certain level of testosterone, and the more you get after that, it doesn't matter. It will not affect or impact the prostate. There are hormone-sensitive receptors in a women's breast tissue. You've heard of them being positive for those receptors. And so those individuals, you have to be cautious about using bioidentical hormone replacement therapy. So with a family history of cancer and not a personal history of cancer, you need to take that into consideration. But this would be an individualized therapy. And the doctor would have to know the patient, get their history, see what their risks are. Are there other risk factors? Are they morbidly obese? Do they smoke? Other things that can cause cancer as well needs to be evaluated. But I have had patients that have had diagnosed with cancers that have successfully been treated with bioidentical hormone replacement therapy. It's been life-changing for them, and they greatly appreciate being able to do that because they feel more feminine if they're a woman, feel more manly if they're a man. Great question, Ernest. Man, you've been reading. Okay, I have no thyroid because of cancer. My doctor changes my dosage of Synthroid about every 2 months. Is that normal? What else can I take to balance it out? No, it's not normal, but that doesn't mean it's not right. Sometimes a unique treatment regimen is arrived upon by trial and error and based on a variety of things. If you had thyroid cancer, then you might have antibodies that are eating up thyroid replacement. So you're getting thyroid hormones, and your antibodies are eating it up. So you start off on a lower dose that was appropriate at first, but now it's taking higher and higher doses to maintain you at a certain level. So I'm glad that he is monitoring it as often as every 2 months and making adjustments as needed. So, but the key thing with thyroid replacement, as I've told you before, you have a range of normal. This is low and this is high, and everything between my two hands is normal. You want to be on the high side of normal. That's low. You want to be on the high side of normal here, and sometimes even outside of it. You can be that high. That optimizes your thyroid replacement. The biggest problem with thyroid is under treatment. Oftentimes, as soon as you're in the lowest of the low of normal, the doctors stop raising the dose, and they need to continue to increase the dose to optimize your metabolism, optimize your mental alertness, increase your muscle mass, decrease your body fat. And remember, the thyroid gland is your body's thermostat. It's what tells your body how to feel, how to look, how to act, whether you're hungry or not, and whether you want to store food as fat. So it's a very important gland in your overall health. And sounds like your physician is in a great place with you. He just maybe needs to spend a little more time explaining to you why he's doing what he's doing. In that, but it sounds like this is a great attention to your particular case. So I will go along with that. Great question, Yvonne. We appreciate you. Shanta Jackson, Pillichet. My father suffers from chronic edema. What's a good treatment plan? Are there supplements that he can take? Edema causes inflammation, so he definitely needs to be taking some anti-inflammatories. So vitamin D and omega-3 fish oil are very good for that. The chronic edema can be caused as a totally outside the box condition that's called lymphedema. You just have it because your lymphatic system is not working or it's blocked or obstructed in some way. Then there's edema as a symptom of disease states such as congestive heart failure. So it's important that the correct diagnosis be made because one, you would treat with aggressive diuretics and those are water pills, etc. Others, the water pills not gonna make a difference. And so the only thing that would happen is you will lower a person's intravascular volume, probably make them lightheaded and dizzy. Lower their potassium because you're giving them aggressive diuresis, and then they'll have issues associated with low potassium. Then you got to replace the potassium. You can get too high potassium, cause cardiac arrhythmias, heart attacks, and strokes. So it's a more complicated versus a simple, but the underlying baseline is the inflammation. And so you want to minimize the effect of the inflammation. Oftentimes the skin is strained. It becomes infected from scratching or cracking open. And so you end up with cellulitis or lymphangitis, which is, can really be a chronic problem with that edema. So also compression socks and or stockings are very important so that there's no space for the fluid to collect. Now, if he's chronically edemic, then they need to decompress him and then keep him on. He needs to be comfortable wearing. It may be something as simple and elegant as men's over-the-calf support socks, or it may be the prescription type of TED hose that you see people wearing that are kind of beigey and not that attractive to wear, but sometimes unnecessary. But they have various colors now. The technology has improved tremendously. You don't have to have prescription strength stockings. You can just get over-the-counter compression socks, and those are more than adequate the vast majority of the time. But it is a chronic condition that's going to require chronic attention. And again, we just want to make sure that if it's due to congestive heart failure, that his heart function is being optimized. So he needs to be good friends with his cardiologist as well. Great question. Marco, my daughter has problems with her stomach when she eats something, and she has been to a specialist. They told her they couldn't find anything wrong. So, Marco, she needs to get a blood test for food allergy. It sounds like she has some leaky gut syndrome that's oftentimes misdiagnosed as everything from irritable bowel to gluten intolerance, and it's none of those things. It's just that you need to correct that leaky gut, and the simple and elegant way to find that out is just place on some probiotics. And the same probiotics are found in common everyday yogurts. You can eat a Greek style yogurt, which has the highest percentage of good bacteria in them, or probiotics. And so Greek style yogurt, any type, any flavor, doesn't matter. Or you can get the Activia brand yogurt, which has a special level based on optimizing your GI health. Or you can take a probiotics. The Lipobiotics would be ideal for that situation. Taking 1-2 capsules a day, that would help change everything as far as that goes. That's a simple way, that's an elegant way, and it's an inexpensive way to treat those symptoms, and more often than not will resolve and improve GI function. But again, blood allergy testing is something that's very simple now. It literally takes 1 drop of blood. They can do it with a finger stick specimen. They put 1 drop of blood on a card, they let it dry, they mail it to the lab, and they are able to diagnose an amazing number of indoor allergens, which would include cats, dogs, mice. Why horses, I don't know. I don't know anybody keeps horses inside, but horses are on the indoor allergen panel. They test you for moles. They test you for things like penicillin allergy. They test you for outdoor allergens, which would be trees, grasses, and pollens. So oftentimes that test is specialized to the area that you live in. So because it doesn't make any sense to get tested for palm trees here in Atlanta, because there are no palm trees here. So, but they localize the evaluation of trees, grasses, and pollens to what's in your area. And then those are your outdoor allergens. And then they test you food allergens, things like shrimp, chicken, eggs, bread, wheat bread, barley. A lot of people eating wheat bread, and they're allergic to wheat bread. They need to eat white bread. A lot of people have no idea they're allergic to shrimp, and they have shrimp, particularly as an appetizer, multiple days per week. Strawberries, tomatoes, and that includes pizza sauce and ketchup. I have to remind people, if you're allergic to tomatoes, you can't have those things either. So the ability to do food allergy testing has changed not only my practice, but how I treat patients with these types of GI problems, because it oftentimes makes a diagnosis. Doesn't require you to get an upper endoscopy or lower endoscopy, all these various tests that they will do that are very expensive and rarely result in changes in how you're going to be treated. So the simple thing to do the food allergy testing. When I see that you're positive, I just place you on the probiotics, and then we can recheck you in 6 months. You should be doing much better in a very short period of time, not 6 months, but in 6 months, I can repeat the test and show you how your response to certain foods has changed. And now you might be able to add those things back into your diet. But I use food allergy testing routinely for my patients that have diabetes, my high blood pressure patients, and my patients that are overweight and are trying to lose weight, or people complaining of things like a swollen stomach, feeling gaseous, etc. Oftentimes, that can be a food allergy as well. Great question, Marco. I appreciate you. What can you take for arthritis? The itis that will get you. Arthritis means inflammation of. So anything that has itis, such as appendicitis, cholecystitis. Appendicitis, inflammation of the appendix. Cholecystitis, inflammation of the gallbladder. Arthritis, inflammation of the arthros, or the joint. That is all Latin. So inflammation of the joints can happen from top to bottom. The most common arthritis that people have is osteoarthritis, or OA. It predominantly affects the knees, the hips, and sometimes the hands. You get big knuckles, and they call those things osteonodes. It affects this knuckle and this knuckle. This is called the DIP, the distal interphalangeal joint, and the MIP, the midphalangeal joint. And those two swell up. So you don't have big knuckles, you have what are called osteonodes, and that is diagnostic of osteoarthritis. Rheumatoid arthritis spares the distal fingertips. It affects the middle joint, the joints here, and the wrist. And oftentimes, rheumatoid arthritis will give you disfiguring joints. So your fingers, instead of your hands looking like this, they're looking like this, or some variation thereof, or they can lose their tendon, not be floppy. Those kinds of things are easy to make the diagnosis. It's a condition of inflammation. How do you treat inflammation, Sandra? Anti-inflammatories. The two easiest and most natural anti-inflammatories to take: vitamin D, Doctor's D, 5,000 units per day, and omega-3 fish oil. Those two things. Other anti-inflammatories are the class of drugs known as NSAIDs. That's aspirin, Motrin, Advil, Aleve. All of those drugs are what are called non-steroidal anti-inflammatories, or NSAIDs. Steroids can be used for bad arthritis. Oftentimes prednisone is used, and other steroids can be used to calm the inflammation down. Then there are non-steroidals, or the non-NSAID type anti-inflammatories, the COX-2 inhibitors. Those the two most recognized drugs are Mobic, meloxicam, and Celebrex, cephaloxabine. Those two are absolutely amazing. They were kind of invented, for lack of a better way of putting it, for people who could not tolerate NSAIDs, because long-term use of NSAIDs can irritate your stomach, cause gastritis, or even stomach ulcers. Now, there are new biological treatments as well for arthritis. There are orals, there are injectables, and they have found that a lot of these biologicals that are made to calm down the joints also help with things like irritable bowel and other autoimmune diseases. So the spectrum of disease states that are being covered by these types of drugs has increased exponentially. They do limit the responsiveness of your immune system. So it's important that you not have a history of tuberculosis or other infectious diseases, and no recent immunizations when you start those medications. But they are life-changing as well. Again, biological, immunological drugs that are used to treat the condition of arthritis. All right, great question, Sandra. Roxanne Williams, any of the products will help with pinched nerves. Pinched nerves, let's clarify so that everybody knows what we're talking about. Pinched nerves is when a nerve coming out, usually of the back, where the disc in the back, where you have the vertebral bodies of the back, they're stacked on top of each other, and there should be a space between them, and that space has a cushion so that the two bones never in contact with each other. Whereas we age, those cushions lose fluid and they start to shrink. You also get arthritis changes in your spine, so they start to get inflamed, and you can actually get bone on bone. The bones can start to deteriorate even further. That's called spondylitis, inflammation of, and then the spinal vertebra can even shift. That's called spondylolisthesis. And all of these are very, very, what happens when anything in that area moves is moving toward or away from a bundle of nerves. And nerves are very sensitive. If you just barely touch them, it sends an electrical shock sort of feeling throughout whatever the distribution of that nerve is. So how do you treat a pinched nerve? One, you treat the inflammation. Two, you unpinch it. Oftentimes it's a surgical procedure to do that. People have operations on the neck and the back to unpinch nerves. But there are some newer therapies now utilizing lasers. They make a tiny incision that's really about as big as fat as a large needle. That apparatus has cameras in it. It also has laser capabilities. So you go in, you spot the bulging disc or the prominent bony spur or whatever, and you just zap it with the laser, and you finish. You put a band-aid on a person, they get up and walk away. Amazing therapy for chronic back pain, pinched nerves, if you will, ruptured disc, etc. That doesn't require long-term recovery, because the old school option is to cut through the skin, all the back muscles, to get down to the spine to relieve that pressure. And oftentimes the surgery does more damage than there is damage when you are trying to recuperate from it. So it's very, challenging to get back surgery or neck surgery nowadays. But there are newer surgical techniques, again, utilizing a lot of the technology, including lasers, that make these processes much easier to tolerate and much easier to recuperate from. So, great question, Roxanne. We appreciate you. Next question. Mixed siblings. Okay. Can I take the lipo drops that you advertise for weight loss if I'm diabetic type 2? Absolutely. Type 2 diabetes is not one. The most common problem with type 2 diabetes is being overweight. The most commonly recommended therapy is losing weight, and the lipo drops will help you do that. And it will also help you lose the type of weight that you want, particularly the abdominal fat. If you have a pear shape or an apple shape, then it's really going to help control the diabetes as well. When you lose the weight, you're going to have better control of your diabetes, and you're going to have better control of the long-term sequela of the diabetes. So losing weight by any means necessary will help with that. The lipo drops is one way to do it. It will decrease your appetite. It will help you lose the muffin top, so to speak. The abdominal fat is going to target, and you should get great benefit from that. So it's no contraindication if you're diabetic, if you have hypertension, if you have high cholesterol. Those three disease states all are tied together in a condition called the metabolic syndrome. It's three of them. It's like a pyramid. And so you have high blood pressure in the corner, you have high cholesterol in the corner, you have diabetes at the top. If you have the two bases, the high blood pressure and high cholesterol, chances of you becoming diabetic are very, very high. So it's best to control all of them. All three should be treated at the same time every time you go to the doctor. Don't let them compartmentalize your metabolic syndrome and just say, oh, we're going to deal with your diabetes today, and the next time we see you, we're going to talk about your blood pressure, and the next time we see you, we're going to talk about your cholesterol. All three of those components of the metabolic syndrome need to be addressed each and every time, and each one needs to be controlled. It's very difficult to control either of them if you don't control all of them. And so you will find that when your blood pressure and your cholesterol are controlled, your diabetes is much easier to control. So, again, doctor needs to look at it globally and treat each of those disease states at the same time. Great question. Okay. Lavanda Adewale. How can I do intermittent fasting with the work schedule, working from 7 a.m. to 3:30 p.m. 5 days a week, and working a second job 3 days from 7 p.m. to 7 a.m.? Okay, why are you doing too much working? But yeah, there's no, that type of work schedule is going to result in long-term chronic sleep deprivation, which makes you gain weight, increases your stress level, predisposes you to high blood pressure, which predisposes you to diabetes at that point. So very important that you do that. But you just choose an 8-hour period in that daytime. Since you're working from 7 a.m. to 3:30 p.m., you could eat, which all you're going to eat in that day from, say, 10 to 5. 9 to 5 or 10 to 6, and that way you have your 8-hour period in, you covering your shift, so you have some fuel in your tank for that second job from 7 p.m. to 7 a.m. and you just don't eat anything after that last meal, which in your case would be 6 or 7 p.m. So you can do the intermittent fasting. That's not the only option for you. The other option, which may be more difficult because you're working such long shifts, is eating 5 times per day. That's breakfast, that's lunch, that's dinner, with a snack in between breakfast and lunch, and a snack in between lunch and dinner, so that you are never hungry. Your body does not interpret that you are hunger or feels hunger, and so it's not going to store any food as fat. It's going to release any calories that you don't need and or burn them as fuel. So those are the two options, the two most popular things. But you can make intermittent fasting work within that schedule. And actually, again, you eat before you go to the 7 p.m. job, and that's the last time you eat. Even though you're working to 7 a.m., you don't need to eat overnight like that. And that is the biggest problem for people that work shifts in that manner, is that they spend the second half and the latter portion of that shift, when things slow down, eating, and they start to gain weight. So people that work an overnight shift, there's studies been done in various professions, including nursing, that shows within 6 months of changing that shift, most of the people have gained a phenomenal amount of weight because of the poor eating habits, and 2, lack of opportunity to burn those calories, and sleep deprivation. So it's a problem. We need to not have you working so much 3 days a week, 7 p.m. to 7 a.m. And then
7:38. And I know sometimes it feels like it's an economic necessity to do that. But working all the time, you have no life. You can't go out, you can't enjoy your friends, you can't enjoy your family. Take more time off and make life work for you. The only thing that will happen at the end of all of this is you'll get a 2 minute acknowledgement, a memorial, and then they put somebody else in a position to do what you were doing. So take some time to smell the roses, as they say. Enjoy life, decrease your stress level. If that requires you to make some economic decisions, that's fine. Or change your lifestyle so that it's not required for you to work that much. I know it's very difficult to do. It's very easy to say, but again, you will appreciate it because you just have more higher quality of life, and quality of life is key. Quality of life is key. Best information I've given you today. Quality of life is key. Great question. Great question. What I think of the lipo shots I'm hearing more about. We use lipo shots in my weight loss clinics. They are various names: lipo shots, lipo bite, because it's a combination of amino acids and vitamins. And they are great. They are amazing. They work wonderfully for weight loss. The problem was that, one, some people don't like shots. Two, some people couldn't come back to the office to get shots. So to get the shots and to make them work optimally, you need to come in and get a shot once a week, which everybody starts off with a lot of enthusiasm, but eventually life intervenes. And 2 to 3 months in, they start missing shots. And so they miss the opportunity to lose more weight. So the lipo drops gives you the exact same medication in a sublingual application. That means it goes under your tongue, which delivers the medicine exactly as if you had gotten an injection. It's virtually the exact same when doing so. The area under the tongue is very absorptive. It absorbs everything that's in the lipo drops in 2 minutes or less, and it gives you all the benefits without you having to use a needle. And each bottle of the lipo drops has a 1 month supply in it. So that's 4 visits that you don't have to make to the weight loss facility, and you can still benefit from using that particular method of decreasing your appetite and increasing your metabolism. So that's what that is. That's not new. You hear more about it because people are talking about it now. But again, it's what they've been using at weight loss facilities for the past 15 to 20 years without question. Great question. Makiba, so glad to see you. Thank you so much for tuning in. Black Lives Matter, and so do you. Is Benadryl okay to take with congestive heart failure? Yes, it is. Benadryl is an antihistamine. Antihistamines do just that. They block the histamine response. And so the histamine response usually results in swelling or edema. So blocking the histamine response stops that from happening, and should always be a benefit in congestive heart failure. So I don't think that taking any antihistamine, Benadryl being one of them. Benadryl is a classic antihistamine, usually taken in a 25 to 50 milligram dose. The most commonly available is 25 milligram over-the-counter tablets or liquid, but they will say take 1 or 2 tablets, and it gives you relief from the histamine response for about 4 to 6 hours. Yes, there's no contraindication that I'm aware of with Benadryl in congestive heart failure. So I would say if congestive heart failure is an issue, please discuss this with your cardiologist to see if there's something magical that Dr. Collier doesn't know or doesn't understand, and that and they may say, no, nobody takes Benadryl with congestive heart failure, and this is why. I'm just unaware of any in my medical practice. So great question, Makiba. We appreciate that. Okay, Miss Logan says, Patrice Logan, I've had chemo due to colon cancer. Since my cleanup chemo, I noticed memory loss and attention problems. My doctor mentioned chemo brain. If the chemo is the reason, can it be reversed? Chemotherapy is toxic therapy. The objective of all chemotherapeutic agents is to do more damage to the cancer cells than it does to your normal cells. The way that it isolates the cancer cells are that cancer cells have a high metabolic rate. So the cancer cell will get more of the toxic chemotherapy than a normal cell would. But how much is enough to insult a normal cell? Other high metabolic rate cells in your body are the cells that make your hair grow. Your hair cells are very high metabolic rate, which is why more often than not, when people are getting chemotherapy, they lose their hair, and not just the hair on their head, but their eyebrows, sometimes even their eyelashes. And so any tissue in your body that has a high metabolic rate can be lost with chemotherapy. So the damage that's done on the endothelial level, or the cells that line the brain and provide nutrition to the brain, they can be damaged as well. So with endothelial dysfunction, you can lose brain tissue proper, which will result in memory loss. So there are things that you can do to stimulate your brain, and believe it or not, there are brain activities like word find or Sudoku puzzles. And then I would also take anti-inflammatories. I keep restating vitamin D, omega-3 fish are great for brain metabolism and to renew brain tissue. There are some things that I hear about on the internet. People are talking about, improving brain function. I won't mention any names because I'm not necessarily agreeing with what they say they do, but I have patients that swear by them. So I tell people, if it happens 1 out of 1,000,000 times and it happens to you, it's 100%. So if it's working for you, I don't dispute that, because I don't know how your brain is working. And you tell me that you feel better on it, that's good enough for me. So chemo brain and any other tissues in your body that can be damaged by chemotherapy, tincture of time, your body will heal itself. And congratulations for being cancer free at this time, hopefully. And then, just the things that you need to do to optimize your nutrition. You are what you eat. You need to be eating a lot of healthy, crunchy fruits and vegetables. You need to be taking your probiotics. You need to be taking your omega-3 fish oil and your vitamin D, and optimizing the supplements that you can take to allow your body to heal itself. So good luck with that, Patrice. We are rooting for you and keeping you in our thoughts and prayers. Thank you so much for a wonderful story. Angela Haynes Lewis says, do I still need a multiple vitamin using the keto kit Lipo drops? Yes, you do, because the Lipo drops do not have a multiple vitamin in them. They have B vitamins and C. So it's important that you get all the other vitamins that you need. So Dr. Collier states, and we'll restate here, you need to take a complete multiple vitamin with iron and minerals every day, male or female. A vitamin is a fixed chemical formula. There is no better way to make it. So if you're paying more than $10 for a bottle of 100 vitamins, then you're paying for a pretty bottle, a celebrity endorsement, or a commercial. So it's very important that you understand this. And it's not like that with a lot of things, but with vitamins, it is. They're fixed chemical formula. Just make sure the key word in that sentence is that you're taking a complete. You made a statement. You said, do I need a multiple vitamin? Yes, you do, but you need a complete multiple vitamin with iron and minerals. That is in addition to the lipo drops. That is in addition to the vitamin D or the omega-3 fish oil. Name brands I recommend: one a day for women, one a day for men, Centrum, Z-Bec, or any bottle that's labeled the store brand, the Kroger brand, the Publix brand, the CVS brand, whatever, that says compare to, as long as the label says a complete multiple vitamin with iron and minerals, then you are good to go. All right. Recommend you take them every day as well. Great question, Angela. Okay. Daniette Jones, how do you prevent weight gain when on steroids? It is unavoidable. There is no calories in steroids. I remind my patients of that. But taking steroids will oftentimes result in weight loss, as well as result in high blood sugars, and sometimes either makes diabetes worse, more difficult to treat, makes more medicines required, or brings it out. You are not diabetic. You took steroids, or you're taking steroids for whatever reason, and now you're diabetic as well. So steroids are very, very important in our inflammatory disease states. They're sometimes the only therapies that are available. Sometimes they're the optimal therapy that is available. That could be anything from asthma to lupus that you may need steroids. So there are inhalable steroids, which have less of a systemic effect. But if you're taking oral steroids or taking steroid injections, then it's important that you be conscientious about the calories that you're breaking in, because you don't necessarily have to eat more, because the steroids will convert those calories that you are already eating into fat. So you might need to monitor, one, the types of foods that you're eating, two, the amount of foods that you're eating, and cut your portions down. So it is unavoidable. You can get it. It's not unavoidable, so to speak, but it requires some conscientiousness. And don't wait until you're already 20 pounds up before you decide it's time to do something. If you're going to be on long-term steroid therapy for whatever reason, Have that discussion with your doctor that's writing those prescriptions and saying, what I do to prevent weight gain starting day one, so that you're not trying to beat back 20 pounds of weight gain because you had to be on steroids for 3 months or 6 months or during the allergy season or while you were having a flare up of your autoimmune disease, something like that. Again, can be prevented, but very difficult to stop once it started, and very difficult to lose that steroid induced weight once you stop taking it. If you continue to take them, then you definitely need to be on some good anti-inflammatories to help with that. Great question, Danielle. Janae Allen. I was diagnosed with diverticulosis, and when I got to make a bowel movement, it seems like my sphincter sticks out. What should I do? Your sphincter doesn't stick out. That may be hemorrhoids, diverticulosis. You could actually have a diverticulum that is sticking out. A diverticulum is a finger-like projection, that is along the lining of the intestines. It can be the large intestines. It can also be the small intestines, but more commonly it's the large intestine, more commonly the left side of the large intestines. You can have one diverticulum. You can have multiple diverticulum. When you have multiple, that's when you go from having a diverticulum to diverticulosis. Osis means condition of. Itis means inflammation of. If the osis, the diverticulum, becomes inflamed, you now no longer have diverticulosis. You have diverticulitis, which can be a medical emergency. So very important, but more often than not now, it's not treated with surgery. It's treated with just antibiotic therapy and a high fiber diet, so that you don't have to strain when you have a bowel movement, because when you sit on the toilet, when you increase your intra-abdominal pressure, you push it out, you go, that is when you can blow out a diverticulum, or when you can aggravate a diverticulum. Also, foods like nuts and seeds like watermelon or apple seeds or any type of seed from a fruit can get stuck inside a diverticulum and cause inflammation and ultimate diverticulitis, and possibly a ruptured diverticulum, which is basically a ruptured appendix. It's the exact same type of thing, and where you're getting food and possibly feces dumped directly inside your abdomen. That's a medical emergency as well. So got to be careful about what you eat. Again, I highly recommend the probiotics. You need to be on natural anti-inflammatories. That would be the omega-3 fish oil and the vitamin D. And also you need to be very conscious about what you eat and straining at a bowel movement. So if you're straining hard enough to push out a diverticulum, then it's taking you too much effort to have a bowel movement. So we need to put you on a good bowel regimen so that you're not having that issue. So when you do go, you're having large, easy to pass bowel movement with no problem. We have a product on our website called Lipo Cleanse that will give you just that benefit. So go to the website, lipodrops.com, and seek those answers that you're seeking. Find the answers that you're seeking in reference to your diverticulosis. Great question, Janae. We appreciate you. What Lipo Drops do you take on a daily basis? Thank Roxanne. I take the Lipo Drops Maximum Formula. We have the original Lipo Drops. We have the Maximum Strength. We have the Lipo Drops with African Mango. I do like the Lipo Drops with African Mango. African mango is a natural appetite suppressant, as well as it increases your metabolism. And so it's kind of 6 in one hand, half a dozen in the other. I like both of them, and depending upon what kind of mood I'm in or what, I think the Lipo Drops with African mango taste better. They have a mango-y taste, for lack of a better way of putting it. And so depending upon what kind of mood I'm in, or whether I want to just switch it up, or if I've been bad and I need to maybe drop a few more pounds, I may take the Max. If I'm trying to maintain or drop a smaller amount of weight, I'll take the Lipo Drops with African mango. So all of those products are options. And so you go to the website, see what your goals and your objectives are, and then it will recommend what you need to take based on what your goals and objectives are. If you need to lose 5 pounds, if you need to lose 50 pounds, if you need to lose it in 1 week, you need to lose it in 6 months. All of those things and factors will determine which products are recommended and how well you would do on each product. So great question, Roxanne. We appreciate you. Is it true that women over 60 don't need as much iron as women 20 to 50 years of age? If true, why? 2 reasons. Kathy, you get the answer. You get the question, or the award for the best question yet. 1, because women over 60 don't have menstrual cycles. And women that are under 60 are women of what's called childbearing age. They lose more blood every month and more iron every month with their menstrual cycle, then they usually replace with their diet. It's just not a lot of iron in foods that people choose to eat. There's a lot of iron in crunchy fruits and vegetables, but people aren't eating them. Steaks would have a lot of iron in them. People aren't eating them. They're choosing vegan lifestyles. They're eating more chicken and fish, and so they're not getting the iron that they need to replace what a woman is losing on a monthly basis every time she has a menstrual cycle. So once you're menopausal, you no longer have a menstrual cycle. I have women who have been anemic all of their life. They go to menopause or they get a hysterectomy. Anemia is cured magically because they're not bleeding every month. That's where we are with that. So great question. And our final question for the evening. So we want to thank each and every one of you for participating tonight. We think that you are wonderful, and we wanted you to know that here on the Your Health is Important broadcast, we want you to join us every second and fourth Wednesday at Ask Dr. MJ on Facebook. We hope that you've gotten some of your questions answered and that all of your health status has been optimized. But remember, the 3 things that Dr. Collier recommends every day for everybody, male, female, young, old, things you need to take. The Lipo Biotics every day, 2 capsules per day. Doctor's D, vitamin D at 5,000 international units per day. And then Lipo Omega, the omega-3. And for those who are trying to optimize their chances of not being cancerous, you want to get that vitamin D level up to between 60 and 90. That means you need to go to our website right now because we have a special going on right now. For those individuals that are concerned about that, you can get your vitamins D levels up and protect yourself from men, prostate cancer, women, breast cancer, pancreatic cancer. All those cancers have been shown to be responsible or receptive to vitamin D therapy. And the first thing that happens when a person gets a diagnosis is that they place them on vitamin D therapy. So enter the code NOCANCER15 at checkout when you're ordering, and you can get your vitamin D products and optimize your health. Thank you once again. We appreciate you. Go to get the Best Life Essentials. That's the 3 products that we talk about. That's the omega-3 fish oil, the vitamin D, and the probiotics. Products that Dr. Collier takes each and every day himself. And we are so glad that you remain healthy. Why? Because your health is important. Thank you so much. We'll see you next time.